Good afternoon, everyone. And again, thank you so much for joining as we start this information webinar for the Virginia Earn to Learn Nursing Education Acceleration Program. You want to first acknowledge it is National Nurses Week from May 6th to May 12th. And we have a great start to this initiative as we start this week. So again, thank you for joining. And we're going to go ahead and begin. Again, this is the Virginia's Earn to Learn Nursing Education Acceleration Program information session, and we are glad that you have joined us today. Before we get started, just some housekeeping. All lines will be muted for attendees. Please use the chat box for questions. We will have time also if you would like to raise your hand for questions as well. But please also use the chat box. Questions will be addressed throughout the webinar. Also, if you would like to do closed captioning, please be sure to select that via Zoom. And then again, this webinar will be recorded and will be made available to all registrants, but then also it will be placed on our VDH OHE webpage for those that may not have been able to attend or register at this time. And again, this is Virginia's Earn to Learn Nursing Education Acceleration Program pre-proposal conference call, our information session. For today's agenda, we will first have greetings welcomed by our Office Director of our Virginia Department of Health, Office of Health Equity, Sandra Sertna, and I will pass the baton to you, Sandra. And you should be able to
Hi, everyone. Can everyone hear me?
Yes, yes.
Excellent. Okay, good afternoon, all, and thank you so much for joining us on this important information session. Really excited to be able to move forward with selecting the next cohort for the Earn to Learn program. This program is one of many workforce programs that the Office of Health Equity oversees and administers, and all are incredibly critical to ensuring that everyone has the opportunity to be healthy in the great state of Virginia. So excited for you to be here and to learn what is required with this new RFP. And I will go ahead and pass it on back to Veronica so we can get started. But thank you for your attention and your commitment.
Thank you so much, Sandra. I am Veronica Cosby, Virginia Department of Health, Office of Health Equity. I oversee our Virginia Partners in Prayer and Prevention, and also I'll be working with the Earn to Learn program as we proceed as we exist and we have cohort 1, but also with cohort 2. And also we will have additional speakers today as we review the RFP, Latoya Green, Procurement Officer with the Office of Procurement General Services, and then also Kimberly Bomey, the Director of Procurement and General Services. So we will follow each other and we will be reviewing this RFP. If you have any questions, please, again, use the chat menu and we will start from here. Request for proposal, VDH 25-5510132. The date of May 1st, 2025. Closing date for this award is going to be for applications will be May 30th, 2025. This is the Virginia's Earn to Learn Nursing Education Acceleration Program. The period of the contract will be July the 1st, 2025 through June 30th, 2026. And this is non-renewable. The maximum amount available for this 12-month project period is $400,000 for each recipient, and there will be multiple awards. Our first cohort, we did award up to at 13. So please know that this is for multiple awards. For a little background in regards to the Earn to Learn initiative, Virginia Department of Health, Office of Health Equity is seeking proposals for the Virginia's Earn to Learn Nursing Education Acceleration Program. The purpose of this request for proposals is to establish contracts with nursing academic, clinical partnerships to transform nurse clinical education and accelerate development of practice-ready nurse graduates as part of the Virginia Earn to Learn's Nursing Education Acceleration Program. Through the Earn to Learn program, the Commonwealth will support collaborative clinical training arrangements between educational institutions, hospitals, healthcare providers to increase the number of nursing students receiving necessary clinical training to achieve certification or licensure, creating employment opportunities for nursing students, to produce nurses who transition to nursing practice more effectively and efficiently, and to retain nurses in Virginia. As we talk about the Earn to Learn model, I do know we have Patty Lisk in the actual audience today, and we would be remiss not to acknowledge the Earn to Learn model, which was published by the Virginia Hospital and Healthcare Association. This model is a growing body of evidence that suggests that the better workforce program outcomes comes from programs that incorporate hands-on work-based training alongside academic training and includes access to one-on-one career navigation assistance and other wraparound services. Within the RFP, you will see that have this information and also identify other state agencies, but other universities that have included this model, such as California's Department of Health, Care Access and Information, also University of Virginia, Germanna Community College, and Mary Washington's Healthcare Nursing Assistance Pilot Program. These are great examples for you, but this tool, the Earn to Learn Earn While You Learn toolkit, is essential to the work of this RFP. And our next slide will actually go over a little highlight the phases of that. I would like to ask Miss Patty Lisk, if you would like to, one of the actually publishers, one of the writers of this toolkit, to highlight the phases that are on a part of this clinical model. Patty, are you there?
Oh, you let me off mute. Thank you. I am here.
More than
It's
welcome.
good. It's good to see all of you today. Yes, the Earn to Learn toolkit explains everything that I'm going to talk about, but essentially there are three things that need to be in place for you to have a successful model. The first one would be an advisory board. An advisory board is comprised of people from your academic institution and your clinical partners that are supporting your Earn to Learn model. They meet together regularly. When we met every 2 weeks. I know that seems excessive, but at the beginning, you're going to need to meet frequently to make sure you can get all the pieces in place. So first, you need to have an advisory board. Next, you enter into what's called phase one. Phase one is when the clinical partner employs the academic partner's nursing students. Now, this doesn't seem so foreign from what we've done in the past. Lots of our hospitals have employed our nursing students. But these students are intentionally employed in phase one, and because they're in phase one and employed by the clinical institution, they are eligible for phase two. No student is eligible for phase two unless they are employed by the clinical facility. So that seems like a lot sometimes to nursing students. Oh my gosh, I have to work and I'm in school. We completely understand that. When we implemented this model, we limited the amount of time students could work at the clinical facility when they were enrolled in school. It was 12 to 20 hours a week because from my experience, students who work more than 20 hours a week experience academic difficulty. If a student got into academic difficulty with the 12 to 20 hours a week, they were able to meet with the clinical facility and reduce that number even further until they were able to get through the difficult part of their curriculum. We had some students in their third semester withdraw from the program, complete the clinical semester, and then enter back into the program in their fourth semester. Great news for those students is because they had the wisdom to say, I'm having trouble, and withdraw. They graduated successfully and now are RNs. You always hear Eileen Doman, my cohort in crime, say, our job is to get RNs, not to get nursing students. So if they have trouble, they certainly can reduce the number of hours in phase one to meet their needs. Phase two, so we did this during the pandemic, Eileen and I, and it was initially started because we wanted to help their workforce. They simply did not have enough nurses to meet the needs. You remember the pandemic and how difficult it was, I'm sure. This was like a match made in heaven because many of our nursing students had no jobs. They had jobs in hospitality that had been discontinued because of the pandemic. So they were excited to work in the hospital. Phase two came about because we noticed that there was a marked difference in the ability of the students who had been working in the clinical facility and those who had not. Not that the others were behind, but phase one students seemed to be more confident in the clinical facility than our traditional nursing students. So in phase two, we decided to do something a little different with our students. We decided to put them in what we call an immersive clinical experience. And what we did was we partnered those students with an experienced RN, and we only did it for 36 hours in their third semester using the VCCS Common Curriculum. So only 36 hours with an experienced RN. And then it always had been my goal for them to be paid in clinical. So I always thought students give so much in the clinical area. Wouldn't it be great if they could get paid? And many of our students, as you know, really do need money while they're in school. So with phase two, that's exactly what we did. We paired them with an experienced RN and we paid them for their time in clinical. The outcomes were unbelievable. Students went from saying, I helped the nurse to I felt like I was the nurse. This is 36 hours later. When the students completed the rest of their rotation with other faculty, because remember, it was only 36 hours of their 500 that they need, they went to other floors and the nurses would say, where did you get these students? These are the best nursing students I've ever seen. So we already had qualitative information that this was making a difference. So by the time we went to fourth semester, we couldn't just not do anything with them and put them back in their traditional model. They too entered an immersive experience. They went for 48 hours. During those 48 hours, some of the students actually worked on night shift. Now you might think, oh my gosh, what are you thinking, Patty? That's what I thought to myself too. What are you thinking? They're going to be at my door. They're going to say, this is ridiculous. What, you have no heart. Well, they were at my door, but that's not what they said. They said to me, thank you for letting me have this experience. I know this is going to be where I am when I graduate. I'm so glad for this experience. So if you talk again to my friend Eileen, she'll always tell you there's no shortage of clinical placements, that her hospital is open 24 hours a day. So if you're having trouble finding clinical spots, I bet you can find them online. So in phase two, Essentially, the students are paired with a clinical nurse who is experienced in the area, and they can go your decision how many hours. We did 36 and 48. Some of the models that we're seeing this time use the entire precepted experience in the fourth semester as a phase two. But remember, the criteria to be in phase two and receive payment as a nursing student is you have to be in phase one, and that means employed by the hospital. What other things can I tell you about it, Veronica, that would be helpful?
Well, I do, while you're here, there are a couple of questions in the chat. So
Oh,
I'm
okay.
going to grab you while I have you. And it says, is this only for RN, BSN students, or can it be used with PN students?
Excellent, excellent question. It can be PN or RN. In fact, some of our recipients, our grant recipients this time are using both PN and RN models at the same school. So yes, both are eligible and both benefit from this. Okay, let's
And
see.
I do also see, does the hours for students are paid account towards board requirement hours?
Yes, they do, because they are direct care hours and they are clinical hours. So at Germanna, what we did with them is we did pair them with a mentor, and that's what we called the nurse who was with them. We paired them with a mentor, but I also put a clinical faculty in the facility to oversee the students to ensure that they were meeting their student learning outcomes. My whole thing through this was to me an experiment. I'll just be honest, a great experiment. I didn't want to do any harm, do no harm. So I put a clinical faculty with them to ensure that they were getting what the other students were getting. As it turned out, they seemed to get more. So that is not a requirement of the model, but a lot of schools are using that to assist in the model. So some schools have gone to the strict preceptorship model with this. Others have used a mentor model with a clinical faculty.
Also, I see if a PN to an RN eligibility.
Yep, they
Yes.
are too. And the good news for them is many of them are in a work role already, because as PNs, they've graduated and they may be working at the clinical facility where they need to do their immersive experience. So that's good news for them. They are already phase one students, many of them. So that's excellent news, and they are certainly eligible.
Also, does the mentorship get paid or stipends, which could be either or combination depending on the institution? And I'll let you confirm
That's
that.
a great question. Yes, the mentors were paid a little stipend above that. I think Eileen paid them $4 an hour more for having the students. Then they can also apply for what is it called? The PIP program, the Preceptor Incentive Program through the state. So they can actually double dip. They can get money from the state and they can get money for this grant for being a preceptor. To me, that sounds very attractive.
Patty, I thank you so much. I know we have a number of questions and we will get to them. We want to make sure we are mindful of our time and your time. Patty, thank you so much. And also Eileen, I wasn't sure she was on either, but thank you both, Patty and Eileen, for this great tool. And this tool is
So I'm going to, Veronica, drop my email address in the chat. And if
please.
you have questions that we don't get to, please feel free to email me.
And then also we will be doing an FAQ that will provide the questions from this webinar as well. Patty, we will make sure that if there are additional questions, make sure that we have your information responses as well. Okay,
Absolutely.
thank you. And again, I did see a note in regards to our question of where can you find the Earn While You Learn toolkit. That toolkit is also embedded in the RFP. If you do visit our VDH OHE page, it is also on the page for Earn to Learn. In the response to this a follow-up to this webinar, we will also be providing that link to the Earn While You Learn toolkit, because it actually is very descriptive in regards to your phase 1 and your phase 2 and examples as well. So Patty and Eileen did a phenomenal job with that toolkit. So as we proceed, I am going to pass the baton to Latoya Green, my counterpart here that's working with this RFP. Latoya, the floor is yours.
Thank you, Veronica. Good afternoon, everybody. My name is Latoya Green. I am a procurement officer too here at Virginia Department of Health, and I am the buyer who posted the RFP in EVA. So if you have any questions or something that you're not sure about, you don't understand, please reach out to me. My contact information is listed in the RFP. Um, as far as your response to this RFP, we're taking our responses in EVA only. So we want to make sure that you are registered in EVA and that you are familiar with how to access the RFP and how to submit your proposal. If you have any questions with submitting your proposals, you want to reach out to EVA customer care directly. Their phone number as well as their email address is listed here on this slide, but it's also listed in the RFP as well. Proposal format and content. So we were very descriptive in the RFP as far as the format that you should follow as well as the required content, so that we ask that you familiarize yourself with the different sections of what's required. We've also provided a sample budget and a sample budget narrative that we ask that you use for your information. As far as the budget line items and categories, we've had them listed here as well, so you want to familiarize yourself. Some of them are personnel and fringe, contractual, supplies, or maybe other items. Again, just make sure that you're very detailed with that, and keep in mind that there are also some funding restrictions. Okay, so any funds from this grant cannot be applied to any land acquisitions, construction projects, general operating costs not related to the program activities, fundraisers, raffles, any meals, alcohol, decorations, or entertainment costs, um, any inventions, patents, or licensing costs, lobbying, sponsorships, um, direct clinical service provisions, equipment exceeding 5,000, or any pre-award costs. Any of those things, if it falls within those restrictions, it cannot be assessed to this grant. As far as the proposal content, we have listed some of the things that you want to make sure you have with your response. You want to make sure that you include any clinical or academic partner MOUs or clinical affiliation agreements that you may have in place. You want to include things like your organizational chart. If there are any current Earn to Learn advisory group members, you want to include their names, job titles, and their job descriptions. Um, be aware that if you are awarded, you are subject to a site visit. Virginia Department of Health makes determination of if or when we would do a site visit, and we will contact those who will be visited. Each contract will have an administrator just to make sure that everything is being fulfilled, and if you have any questions that you have a point of contact to reach out to. Specific proposal instructions. We suggest that your proposal is as thorough and as detailed as possible. We want to make sure we can properly evaluate your responses and as it pertains to your capabilities to provide the goods and services. We want to make sure that you have everything that's required so that your response or proposal can be evaluated. If there's anything missing, you may risk either having points deducted or not having your proposal evaluated. So you want to make sure you have a signed RFP cover sheet with your organization's information. There are some required attachments as well. We have a vendor data sheet, that's attachment one. I'm sorry, attachment A, I apologize. Attachment B will be your small business subcontracting plan. Attachment C will be your Virginia State Corporation Commission registration form. And then also you want to be sure to include your pricing schedule, which is comprised of your budget and your budget narrative. The evaluation and award criteria. So first we want to give you these important dates. Obviously today is May 6th. We're doing the pre-proposal conference, but you want to keep in mind that we have some other important dates. If you have any questions, anything you need clarity on, you want to make sure you get those in by May 15th at 5 p.m. And then for all the questions that we gather, we're going to get those answers out to everyone. We're going to post them and have them out there by Friday, May 16th at 5 p.m. And that way everybody can have the same answers and everybody be on the same page with the information. The RFP will close Friday, May 30th at 11:59 p.m. So basically you want to make sure you get your responses in prior to noon on May 30th. Again, if you are coming close to that date and you're having issues with getting your responses in, we do suggest you contact Eva Customer Care directly. I can answer questions pertaining to the RFP, but as far as Eva and that system of submitting your responses, you want to contact Eva directly. And so we anticipate our awards going out by July 1st, 2025. And okay, so the proposal review information, we will do an initial review for adherence to the guidelines of the proposal. Any proposals failing to provide the required information may be removed from consideration. So again, we encourage you to familiarize yourself with what's required, and so that you can move on to the evaluation phase. Each complete proposal from eligible organizations will be read by a review panel who will rate their proposals using the evaluation criteria indicated in the RFP. We endeavor to ensure all awards are made within each region of the state to ensure the Earn to Learn program opportunities are available across the Commonwealth. Okay, so your program evaluation requirements. Over the course of 12 months, all awarded contractors through the Virginia Earn to Learn Nursing Education Acceleration Program should demonstrate progress in the evaluation areas below. So basically, the requirements that we're going to evaluate you on, we just want to make sure that you are progressing in those evaluation areas. There are reporting requirements. All grantees must submit a project status report that describes the progress in work plan implementation and spending funds. Because the period of performance is for 12 months, formal status reports will be required every 6 months. And we have listed those dates below. So just make sure you familiarize yourself with those due dates and the items that will be due at those times. Some of the special terms and conditions, keep in mind that you could be audited. You should retain all records, books, any type of documentation or information pertaining to this RFP for a minimum of 5 years after your final payment or until you are audited by the Commonwealth of Virginia, whichever is sooner. As far as your award, selection shall be made of 2 or more offerers deemed to be fully qualified and best suited among those submitting proposals on the basis of the evaluation factors included in the RFP. As Veronica just stated, we're going to award multiple awards, so keep that in mind. The agency may reserve the right to cancel or terminate any resulting contract in part or in whole without penalty upon 60 days written notice to the contractor. The solicitation will result in multiple purchase orders. So just keep in mind if the purchase orders are made that you may be assessed a EVA purchase order fee, and this contract cannot be renewed. So this is just for one grant period. Any bid or response that we do receive from you will be valid for 90 days. All right, so submissions of small business subcontracting plan, evidence of compliance with the small business contracting plan, and subcontractor reporting. So as a part of your evaluation criteria, 20 points of your evaluation will account for your small business subcontracting plan. And so this is very important that you do complete this portion of the plan. And basically, we just want to know if you are a small business or if you intend to work with subcontractors that are. And so that's the information that we would need on your small business subcontracting plan. And we will describe that further on because that's one of the attachments. I think it's attachment B. So then when we get to that attachment, we'll point out what you would need to submit with that. Your method of payment, so invoices shall be submitted electronically by the 20th of the month following the end of the month for which cost reimbursements is sought. We ask that you submit invoices in a timely manner. You can either email them directly to our accounting team, which is SBS Central Offices AP at the bdh.virginia.gov, or you may mail them directly to the Virginia Department of Health at 109 Governor Street. As far as a pricing schedule, we ask that you submit a detailed pricing schedule with your proposal, which will include all costs associated with providing the services, proposed cost saving measures for the board, and any other price or cost related factors that should be considered in evaluation of the proposal. And again, this is using the sample budget and budget narrative. All right, so this is what our first attachment. This is the vendor data sheet. It's pretty self-explanatory. It's just asking for the information about your organization. You want to make sure that you put your name, your contact information, your vendor information as it appears in EVA, like your EVA ID number. And it's pretty self-explanatory. It spells out all the different fields. And then at the bottom, you will make sure that there's a signature, date, and title. So attachment B is what I was referring to earlier as far as the small business subcontracting plan. So we have a link to the SBSD, which is a small business website for Virginia, where if you are not considered or identified as a small business, this is the website that you can go to register. Or if you're working with any subcontractors, again, this is where they can go to register to have that small business designation. Over to the right, this is the actual attachment where you would enter the information. So you would again enter your organization's information, and then there's two separate sections. If your organization identifies as a small business, then you will complete section A. If you plan to do business or subcontract with small businesses, then you would list those small businesses in section B. And again, I'd like to reiterate that this portion of your response weighs about 20 points of your overall rating. So we encourage you, to go ahead and fill this out and complete the form completely because it could affect your rating significantly if not.
Latoya, may I jump in for just a minute? This is Kim.
Yes, Kim.
Okay, just to kind of give you all an idea of how we come up with that score. As Latoya said, the SWAM category is worth 20 points. If you are a small minority woman-owned business, then you would qualify for the 20 points. If you are not, and a group of you, probably a majority of you, won't be small businesses, but you might use small businesses, for example, to provide uniforms, or your office products might come from a small business. What will happen is you'll put those businesses and an estimated dollar amount on that form. And then what we will do is take the amount that you plan to spend with a small business and divide that by the amount of your overall proposal, and we will get a percentage, and then the maximum points you would be eligible for would be 15. So the percent you'll use for a SWAM vendor will be multiplied by 15 to give an assigned score. So that's how we'll figure it out. So it is really important that you make every effort that you can to spend some of the funds you might use with a small business if you're able to.
Thank you so much, Kim, for adding a little bit of context to that. I appreciate that. So yes, that's very important. And then that brings us to our last attachment, which is attachment C. This is the Virginia State Corporation Commission Registration Information Form. And so you would just select the option that applies to your organization. And again, that is also another required attachment. I think that's the last attachment that we have, and then I will send it back over to Veronica.
Thank you, Latoya. And just to reiterate, in regards to the last date for questions, questions are to come to Latoya Green. If you have any inquiries on this RFP in writing by email, her email address is listed on this on the RFP, but also on this this PowerPoint presentation. This PowerPoint presentation will be sent to you, as well as the recording as well. I am going to ask Kim, Latoya, also Patty, and Sandra. We do have some questions in the chat that I will go through. You are able to unmute yourselves, and so we can answer some of these additional questions that we have not addressed. It does say, how many awards do you plan to make? I will say that our last award for cohort 1, there were 13. So based on the total award, again, there will be multiple awards, but there were 13 awards based on the last award amount. Sandra, would you like to add anything to that?
Hold on. Sorry, I was unmuting in 2 different places to make sure I got the right button. No, the only thing I'll add to Veronica's point is, that is the award ceiling is 400,000. The reason we were able to give 13 awards the last round is because not every single entity asked for the max amount. So I'm not saying don't ask for the max amount, but obviously if a variety of folks ask for different amounts, that enables us, that gives us a little bit more wiggle room in our budget. So that's really all I have to add to that.
Thank you, Sandra. Go ahead.
Veronica, may I jump in? One
Yes,
of the other things to note with regard to the funding is this is funded with general fund money, and as such, we are not able to do indirect costs this time.
And thank you, Kim, for saying that. That was a question in the chat as well. And so this may be let's see, a Patty question. Can the lead applicant be a nursing program?
So the clinical partner is the lead applicant, and the academic partner is the lead, is the applicant. Clinical partner receives funding from the academic partner.
Thank you, Patty. Does this pay for RN staff mentors and the students? Can the students be used this time for their clinical time?
So in phase one, the hospital pays for the students to work because they are essentially employees of the facility in phase one. They do not get clinical time for being a PCT or CNA or whatever their role is. In phase two, they are paid for clinical. They are in their clinical role. They wear their clinical uniform. They follow your student handbook. They do everything just like a student, except for they have a mentor, and they do get clinical hours for that time.
We are a PN program. If we propose a PN to an AD/RN program, does this proposal need to be approved by the Virginia board to make those PN completing the program site for an RN board exam?
Off the top of my head, I would say yes, that they would need to be approved to sit for the NCLEX. Is that what you're asking?
If the actual person that wrote that question, if you can actually give a response to Patty, they didn't indicate that, Patty. So we will again be following up with your questions and providing an FAQ if we don't provide your response. But if there's clarity, please respond in the chat for us, please. Okay, let's see. Phase two clinical time. Students are meeting clinical objectives spelled out in the clinical course. No double dipping.
That was for me, Veronica. I was
Okay.
answering the question,
Oh,
but
I
I
didn't
said
see,
it
I
to
didn't
you.
roll it all the way down.
So
Thank
phase
you.
one is the work role, no clinical hours. Phase two is clinical.
Okay.
They're just getting paid for it. That's the only difference.
Thank you. Since data will be collected through REDCap, how does that work with the IRB?
The good news for this cohort number 2 is cohort number 1 has figured that out for you. So we have an IRB agreement that you can get signed. We also have the surveys through REDCap. So yeah, it will work out. There's also, I can't remember the last thing we had to get, but VCU got it today. So all that has been worked out.
Okay, I see a question. What is the grant money used for? To pay the RN partners, to pay the student tuition?
The students usually get a stipend for their clinical time. So in most cases, what the stipend has paid for in the work role, say the student gets $20 an hour. In their clinical hour, the number of hours that are designated as immersive clinical hours, they receive $20 times whatever that hour is. And yes, the grant does pay for that. The grant also pays for the stipend for the mentors. It doesn't pay the mentors' whole salary, but if they get $4 or $5 extra an hour for working with a student, it does pay for that. The grant also pays for things like time spent in phase one on onboarding all the phase one students into the clinical facility. It pays for things like your advisory board members to meet. So if you look at the toolkit, there is a budget in there and it shows you loads of things that the grant can pay for.
Just as a follow-up, Patty, to the other question that we asked for a little bit more input, they indicated we would like them to be eligible to sit for the RN NCLEX.
My understanding is to be eligible to sit for the NCLEX, you have to be an approved program in the state of Virginia.
Thank you. If your institution has developed an Earn to Learn model that differs from the VHH toolkit, are you still eligible and competitive?
So you would need to have a phase 1 and a phase 2, but that might be a question you just want to email me about, so I can help you look at it and evaluate it.
And I do also have to emphasize, Patty, that also questions related to this RFP will need to also be sent to Latoya Green in regards to this RFP. If there are additional persons that we have to get additional answers from, please, we will make sure we do so. Just
I will
want to
definitely copy you on anything I send.
thank you, ma'am.
No problem.
And that's for all participants that are hearing the call, because we know we thank you, Patty and Eileen, for your expertise in this as well. Let's see. And I do see that Megan Authors did say my computer froze up. I heard Patty say that there was an IRB agreement on to sign, but after that she lost the rest. Okay.
I was just telling you that cohort 1 solved all those problems for you. Eileen and I did this in the community college system, and to get an IRB through the community college system is quite different than a baccalaureate institution. We found that out really rapidly. So there is an IR agreement available if you need it. If you don't, that's okay too. So I think many of those problems that you're anticipating have been worked out for you, and it'll be much smoother for you this time.
Awesome. Thank you. Can the money be used for administrative support to pay hospitals for clinical instructor support for students?
Yeah. Yes, because one of the goals of the program is to increase the number of students in your programs and therefore graduating in the state of Virginia. So yes, some programs have used it to hire adjunct faculty.
Are institutions with an active ETL award eligible to apply?
That's a great question, and it's one that's sort of up in the air. Earlier, we talked about there being a third cohort, which I think is still up in the air. Sandra can address that better than I can.
Yes, and I will.
Those,
I'm
they were
sorry,
going to do
Patty.
a budget modification as opposed to a full-blown grant. So I think that's a question on several people's minds. Should I apply for this, or should I wait and do a budget modification for the third cohort? So I'm letting you go there.
Yes,
You're
and I
on.
am going to ask Sandra. I know she gave a great example of this in our actual meeting on last Friday. So, Sandra, I'm gonna pass the baton to you. And you may be still on mute.
I was going to say, thank you, Veronica. I also might have to dial a friend and have Kim, our chief procurement officer, jump in as well. So there is nothing in that RFP that technically prohibits anyone, if you already have an active award, from applying. However, as you guys saw, they're going to have to, we require people to apply via EVA. You have to answer in terms of the small business that counts as 20 points that Latoya diligently went over. I think what we would really want to see is if folks already have a pot of funds that they're working through. And right now, cohort 1, for all intents and purposes, their end date is December 31st of this year. If you're applying for an additional second pot of funds, we would want to see what are you doing that is different or augments what you're working on, because in essence, we would be requiring you to track deliverables for 2 separate pots of money, and there needs to be some kind of justification why the agency should be selecting an entity to give them 2 pots of money at the same time. Substantially, there would be a little bit of an overlap, versus giving it to another entity. Kim, I don't know if there's anything else that you want to add to that.
And Kim, you're on mute. And you're unmuted, Kim. Oh. Kim, we still don't have any sound from you. Maybe on your desktop. Okay. We'll give you 1 minute. And just to say, we are actually in 3 offices right beside each other. So you're welcome to come and join me or Sandra. She's coming. And thank you, participants, for your patience.
Okay, that's fine. All right, so Kim is here.
Hello. The only other thing I was going to mention was that we are going to be starting year 2 of a biennial budget. And we do not know what the General Assembly will give to VDH in fiscal year 27. We only know what we have for 25, which is the year we're in currently, and what we're anticipating for 26. So we can't promise that there will be a state-funded phase 3. So I just wanted to make sure you all understood that.
Yeah.
Back to my space.
Thank you. Thank you. This is a team effort. Thank you. Let's see, do we have any additional questions? And I believe, well, Kim has actually answered this partially. Is there a next issue date and proposal submission date after this one? At this time, we are only working to cohort 2, which is the current and present cohort for the RFP for this application. So at this time, we're only offering this opportunity at this time. So we can't guarantee or speak to any additional RFPs or proposals and related to the Earn to Learn. Okay, let's see. I do see, can our institution use grant money to hire administrative support? Yes. Support to better serve ETL students at the primary education students as institutions. I'm sorry, someone came to my door. And Patty, are you still there? And the question again is, can our institution use grant money to hire administrative support to better serve the students at the primary education student institutions?
Yes.
Yes.
Some actually applied and received funding for ETL coordinators, Earn to Learn coordinators that help to handle a lot of the administrative and clinical placement of students. So that's something you might consider as well. Getting those people on board in a timely fashion was tough, I'll just admit out loud, for the institutions, but they have them all on board now and they're going and they're finding them to be quite an advantage in the program. So yes.
Thank you so much, Patty. Thank you, Patty. Thank you, Kim. Thank you, Sandra. Thank you, Latoya, for helping us on today. We have come to the conclusion of this webinar. Again, we will be going back through the questions that are in the chat to provide an FAQ for you. This recording will be made available. The FAQ would be made available for you. If you are looking for links to the toolkit, that is, Patty actually also put that in the in the chat, but also it is embedded in the RFP and then also on our OHE web page as well. We thank you for participating. We thank you for joining us. Today we had about almost 50 registrants and almost like 45 persons to join the call today. So that's exceptional. We do thank you for your time. If I'm going to leave the chat open for a little while, just in case you have questions that you haven't answered. We will not address those questions, but we'll address them in our follow-up FAQ, okay, just in case. So we're going to give you 4 minutes back to your day. Thank you so much for joining Virginia's Earn to Learn Nursing Education Acceleration Program information session, our pre-proposal conference call. Thank you so much and have a wonderful remainder of your day.